information about Part D plans and Medicare Advantage plans both, right? That information is now publicly available. You can you can see there on the left, right? Emails if you have queries. Uh, you can see also here on YouTube. I created this.
Medicare can seem confusing and scary, but it doesn't have to be. It's true, Medicare has complicated rules, a new language, and possible penalties. There are a dizzying number of options. The great news is that you can benefit from Medicare rules if you have unbiased expert guidance. Get your free guidance from J.O., a nationally recognized Medicare expert and author of the best-selling Maximize Your Medicare. Call the number on the screen today. Medicare can seem confusing and scary, but it doesn't have to be. It's true, Medicare has complicated rules, a new language, and possible penalties. There are a dizzying number of options. The great news is that you
Like, look, should not be understated, right? Because this is not a. All right, so let's just see here. All right, everybody. Hello, 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 hello. Let's just make sure that we are sound check here. Morning, everybody. Sound check here. Seems to be working. Good morning, everybody. Right at noon. My name's Jay. Welcome to Jay's Corner. Today, I'm trying something different, which is to simulcast on Facebook, which is the GH2 benefits site, as well as the 2 YouTube channels, all at the same time. Can't find. I'm terrible at this, and so you'll forgive me for my bad videography, if you will. That's just going to have to fly here. Okay, so the headlines come fast and furious. So November 1st, November 1, the individual health insurance enrollment period will begin. The open enrollment period. It actually is the open enrollment period, unlike the Medicare annual election period. Don't ask me why people wrongly use these terms. It is so important. Let me just first say, part of the reason for this channel, for the newsletter, be sure to subscribe to that newsletter, the URL there, right? Which is the fact that, and let me just put this I think I put it in the comments, but I'm going to put it again. These are legal contracts over here. They are written by lawyers in very, very specific terms. I can't stress this enough to you, right? This isn't kinda, sorta, right? These are very specific terms, and these specific terms need to be handled specifically. And the reason is that if you misplace one, if you misunderstood one, and then what ends up happening, you tell a friend, you tell your sister, you tell your brother, you tell your parent, and now all of a sudden, what can happen is, the game of telephone, right? And by the time you get to the third person, like, you have a bunch of like chop suey, right? You don't have a flavor, you don't have a specific cuisine. This is dangerous, is the issue, right? My point here to you is that this stuff is dangerous when you get off on the wrong foot. And the whole reason for Jay's Corner is because of the fact I'm trying to put you on the right foot, the correct setting from the jump. Because if you are on the right foot, then the rest is knowable. I had a interview. It's going to be posted, and then who knows when I'm going to, properly edit it. But it's with a woman. Her name is Suzanne Norman, and she's going to be on where I'm going to, release this video. And she used this word that I actually had never used, but I'm going to hijack and use it from her, meaning that the terminology, the end result of what I'm saying is going to be knowable. It is. I'm convinced of it. It is simply that there's so much noise and jargon. You'll have to excuse me a moment. There's so much noise and jargon that it's easy to be pushed off the track. I'm trying to make sure we stay on the right track. Okay. Down from the soapbox we come, right? And now we're looking at this website here on your screen. This is healthcare.gov. It's this is the federal portal. Okay. Now, your individual site, you may have a state-specific site. Okay. Covered California. for example. New York, California, multiple states have their own individual site. In order to get the advanced premium tax credit, which will lower your health insurance premium, also can lower your deductible and out-of-pocket maximums, right? Depending on your combination. You need to use these portals. You absolutely do. Now, the fact is, it's not that fun, to be candid with you. And you can correctly, presume that we are aligned with most of the states in the country. And I'm going to go through just a survey here of how this is going to look. So the first thing I'm going to tell you is that you're going to see 10 to 15% increases. The sticker price, right? In other words, that the sticker price here is going to increase 10 to 15%. I do think you can anticipate this. A lot of this, that's going to get the ugly headlines, but the reality is that the last 2 years have been basically flat, meaning unchanged. A lot of that has been because, as a result of the pandemic, people didn't go to the hospital for surgeries. People didn't go to to their doctor's offices. You can remember that a lot of locations had trouble, right? Healthcare providers, actually primary care physicians, until the advent of, widespread use of telehealth, which is still going to continue, I would expect. But anyway, my point here is that I know it's easy to say, okay, well, that party's trying to rip me off, or this party's trying to rip me off. I'm trying to defang that and to just get to the facts on how to help yourself. All right, let's just go here. And so this is healthcare.gov. And what I'm going to suggest, and the reason it's so important, is let's just take a look at preview health plans and prices. And I'm just going to use Chicago just as a place, right? Cook County, middle of the country, complicated. So what happens here is you need to go through here, and you do need to be careful here. Very careful. Let's just say the person is married in Chicago with no dependent. Well, let's just call it one dependent. Okay. And let's just call yourself 45, male, etc. And none of these. In other words, you're purely buying for yourself, your family. Your spouse, let's call your spouse 44. Let's use female. If you're same sex, the partnership, you can still apply here. Let's go none of these, and let's continue. And let's call it 16. 16-year-old female, and let's continue. And then you're just confirming. Now, this is the important. Okay, in other words, this is the important part here, which is the household income estimator. Right, so let's just use $50,000, and I'm just making up a number without any presumption. Okay, let's just continue. And this should tell you. In your location, based on the ages of the 3 people and your, right? It's not just one person, it's all 3 in this instance. And now you can see this, it's giving you an estimate on the discount from the sticker price of health insurance premiums. Let's just take a look. And I'm going to skip this. And what you'll see, and I'm not going to look at every plan with you, okay? But I want you to take a look over here. 137 plans available. Your main takeaway here is that the number of plans here, people say, well, Medicare is complicated. Actually, Medicare is simple relative to individual health insurance. Individual health insurance is far more complicated than Medicare. It's not close. It really isn't. Take a look at the number of carriers. So let's just add filters and I'll give you an idea. This is the number of insurance company. 1, 2, 3, 4, 5, 6, 7. Look how many, and the number in the brackets there in the middle gives you an idea of how many plans per carrier are going to exist for this family of 3. And you can see it's a tremendous number of plans. Now, one good thing here is I like this filtering. I do suggest people use the filtering because if you want to have a high deductible health plan and have an HSA, you can apply these filters. Okay. Silver, for example, I do like this, especially if you qualify for this extra savings here. Because now you can apply these filters and now 130 odd. Now you can see what ends up happening. You don't get these combinations. So let's just continue to add these filters and pull off the HSA. I'm very sure that will do it. So instead of 130 odd, and I don't even remember the number, it goes down to 55. And now you have it. Because what has happened here is not only are the premiums lower, there are extra savings. And by the extra savings, what can happen here is the deductibles are lower and the out-of-pocket maximums are lower. Okay, so you can see the tremendous amount of savings here that are possible. That the sticker price here is there in that I've just highlighted in blue. It's not in blue, it's in gray on your screen, which is the original price was $839.63. The new price is $112.63. And this is not me, this is not financial advice here today, right? Always have to say not financial advice. The in here is 727 of savings. So if you just do the quick, now you can understand why I spend time on health insurance. It's not because I'm a healthcare provider, health insurance, not healthcare advice, right? That was my late father, medical doctor. I'm not a doctor. You don't ask me to read x-rays. I'm not going to ask your doctor to give you health insurance guidance. You can understand how important it is now here. Because if you doesn't matter what your age is, right? Now we're 45. You're 45, and now this number here, right here, which I'm going to put in yellow. If all of a sudden your number is minus 727, otherwise than it would have been, 727 times 12 is 8,700. If all of a sudden, if this is now lower by $8,700 in a year, you can see the tremendous impact here. This is not, a trivial number. Don't get me wrong. It doesn't matter what your net worth is, right? In other words, I tell persons, well, there are some, the people who are super well off, they don't care because they have the money. That is totally not the way that they think. I promise you that, right? In other words, if I overlooked some detail which cost my client 80, the client would be hopping mad. And you want to know what? They'd be right. This is available. You do need to understand what you are actually doing here, right? In other words, you need to understand the inputs here on your price. And you can see why I'm making this attachment point. Let's just take a quick look back to the spreadsheet. Oops. Now, there are other tools out there for estimating purposes. If you don't want to go through this, because I'm going to not tell you about specific plans, etc., because that is going to be in a few moments. Up here on your screen is I've got nothing but time for lots of time and kudos for this particular organization, Kaiser Family Foundation. They're keeping it as apolitical as they possibly can, right? In other words, they're not going to ask you there on your website or trying to inundate you with their political view or their philosophical view. They have tremendous resources, and for the most part, they are presenting these facts, as facts. Is it complete fact? Is it a complete set of facts? No, it is not. I've had other posts where I've actually criticized certain findings and the way that certain articles have been stated. Okay, so here we go. You can see it here, and you can now just change your state. So if you didn't want to use healthcare.gov because you didn't want to answer all those types of questions, you can just go into a different state. And let's just use Florida, and you can see the tool here. Let's just use it, Tampa. You can see still no script. Still no time for a script. 33592. Let's just use that. Right. So it's Hillsborough County, big county, right? And we'll go to the same persons. Oh, these are good filters here because healthcare.gov is just purely presuming that you know the eligibility rules. Very good question here by KFF, Kaiser Family Foundation, right? Which is to say that you cannot, in general, you cannot be eligible for APTC if you are offered health insurance through an employer. You cannot. Now, there can be exceptions based on a hardship exemption. Hardship exemption is what it's called. Let me just put that in there. There is something called a hardship exemption. And it's 8.5%. So what the 8.5% hardship exemption is that they've closed a particular nuance. So your health insurance premium cannot exceed 8.5% of your income. And if it does, you get the hardship exemption, in which case you can apply for healthcare.gov. You can see this in certain locations, right? Meaning that you live in a low-cost state, you live in a multi-state, you work for a multi-state employer, and you get socked with some very high hardship exemption and come here to healthcare.gov or your state-specific exchange. Remember, if you have a state-specific exchange, you must use it. Let's continue on and just make it 3. Accept the cookies. Number of children, number of adults, and you can see it here. So you do need to, right? In other words, if one person's going to skip out and the other 2 are going to buy, you need to actually say. 2 adults, use tobacco, no. Let's just call it, what do we say? Call it 45 and 44, right? 45 here, 44 here. Number of children is 1. That person was 16, we put, and submit. And so now you can see now this is very good because the reason that I like this is, and you can see different results. Different. And now you can understand why I don't suggest doing this yourself, right? Absolutely not. I'm biased, right? I'm broker, I'm a seller. That said, you can accept that, my statement as Jay trying to sell you something. Nah, because you can go onto healthcare.gov and find a navigator or someone in your location if you are married to the idea of going to someone who is like close by. Not that that matters anything more in our day of internet. Obviously, you're watching me on the internet. You can see these other levels. These are some nice narratives here Okay. These are some nice narratives here and explaining what is going on inside insurance. This is not complete, but this is specific to health insurance specifically. Yes, are there going to be some technical terms in here that you won't understand? Yes, because not many people understand what actuarial value is. Somebody tried to call me a quant the other day. I think it was Suzanne. Anyway, I wouldn't call myself quant at all. What I am is, applied arithmetic to everyday situations and trying to attach your common sense to it. I'd call it that. That I would call myself. Okay, so let's just continue here. This is a pretty good way of understanding what is going on here. So let me go back here and I'm going to leave the link in the comments section. So by all means, please go to these, use these tools. There's the subsidy calculator. And I'm going to put it into the so you can see, whoops, let's just do it this way. But more importantly, why don't I put it into the comments section? Yep. So, yep. There's the link in your comment section where I've left it there for live chat. There are ways to, at least so you can get the context. So let's get the ballpark. That is not the same as enrolling. Please. Other videos that I've said, you can see them on Jay's Corner where I'm saying DIY. I just can't suggest that because you can come to us for zero. So at the same price, why are we don't give away free options? I'm just trying to get back to practical reality. Here's a way to get to attach to us, and it's basically, oops, that's not the right place, is it? We'll talk about GH2 Unfiltered later. GH2benefits.com is our professional services website. You can go here, online quoting. There it is. You don't need to get these promo codes. So to tell you how bad I am at telling people about all the services that we have over here, I don't think I've ever shown you this window, which is like, like I said, the people who are involved in marketing and give me, professional advice, they're like, you are awful at marketing. Like, not wrong. Anyway, here we go. You can see over here on the left is online quote for ACA health insurance. There on your left here in the upper cell. If I click online quote, what you get is I've got an account here on Health Sherpa. So this is a very well-known website, which is Health Sherpa. Okay. What ends up happening professionally is I'm set up like an affiliate, if you will, but I also have license in most of these locations. Not all, most. But let's just go back to Chicago. Chicago is a place that I would have. And even if I'm not, it's okay. You can continue to navigate using this site. You can see my name, NPN, which is my national producer number. See plans and prices. Yes. So I have a video short. Please share it with others. We're going to go back to our 45-year-old. We're going to add a spouse and let's call it 44-year. Whoops, that's not what we put before. 44-year-old. Add a dependent, 16-year-old. 16-year-old daughter. And so now we go and what did we say? We said 3 people in your tax house. Right? In tax household. This means that if you have a 25-year-old child living at your house, but not filing taxes here, they don't count here. This is why these things are so subtle, because it will throw off subsidy. And if you make an error, an egregious even an error, there's reconciliation in tax filings. So now you can see two kinds of savings: cost reduction, not only a premium, but also cost saving reduction. And that is the lower deductible and out-of-pocket maximum. Important. This dependent here, it's pretty subtle but important. Depending on your state, the child in this instance may, as you can see, the hypothetical 16-year-old might be eligible for Medicaid, in which case they should proceed. Let's continue. Now, I'm not going to put in doctors and hospitals here. It is important to put your doctor, especially. I'm just going to say right here, it's very important to put your doctors. We're going to leave prescriptions. Here's my secret here for today's broadcast. We're going to leave prescriptions to the side. Up come the plans, right? And you can see eligibility now. Nice thing about this is that the site here, you can have different estimates of your household income in today's economy where you have 1099 employees, which is gig. And I'm not saying that only gig, but let's just say, for example, you're independent contractor, right? This is going to vary. You can see if I go from 45,000 to 55,000, you can see this has changed by $50, $600 a year. This is not zero, right? So you don't want errors here. This is continued results, and you see 137 plans. Now, the thing here is we've got all the plans just as we did on healthcare.gov. This to me is a bit more user-friendly, right? We didn't have to answer all those other questions, et cetera, et cetera. You can filter by HMO, PPO. You can filter by metal level. So let's just use silver. Okay. And now you can see, again, just like before, 137 went down to 55. Now, the last point I'm going to make here is prescriptions. Because I'm just going to say that inside of individual health insurance, the big difference here between individual health insurance and employer-sponsored plans, large employer, small employer, is the handling of prescription drugs. Over here on the GH2 benefits website, under useful links, what we have down here, I want to say, yes, down here I've created this little section here because we get asked lots of questions about non-complex or more complicated matters than you would believe. And it's kind of down here, right? Where people want to go on trips abroad. People want to have dental and vision. They have no idea of the context of the price. But over here on the far right column are these two discount cards. You can just click, right? And up will come this place. You can then try to see what your medication is. And let's just call it levothyroxine sodium because this is for hypothyroidism. On Jay's Corner, everywhere you can get one of these cards. I've already made other videos about this, which is you can see this is a pretty big difference in price. I mean, this is, first of all, only half a month. So you've got to handle this carefully. This is for 30 doses. This isn't zero when you multiply this, top to bottom. So you should take advantage of these because there's no loyalty either. GoodRx is known. That's the one that you see on TV. That said, there's nothing special or unique about it. It's just one of many. You can see how big these differences can be. This is not a surprise to me. Like I said, prescription distribution business is probably the craziest commercial business out there. That and traditional book publishing. Unfortunately, my life has both involved, and I'm involved in both. So, today's not supposed to be a pity party. So let's get off that. The issue here is these plans, you'll see over here that in most instances in individual health insurance, you've got to meet deductibles first. And even then, when it's inside, you can see, and there's nothing wrong with Ambetter, right? It is a subsidiary of Centene, part of the Fortune 50, I want to say, right? Huge. But you can see here generic drugs having these different prices, which is way, way different than this. So your key here is if you're using very expensive medications, inhalers, for example, cream, eye drops, then it can be that your insurance works better. However, don't overlook these cards, which I provided to you for free, right? Which is the fact that, and I just put 2 here, here on the website. So again, you go through here and then on client portal and you go to useful links, you'll be able to come up to this page. I'm trying to give you a sense of how fragmented all of these moving parts are. I'm here centered on lowering your premium and your combination. Now, insurance misunderstood, all insurance misunderstood, right? You've gone to your doctor for health insurance advice, right, on financial contracts. That's how far off base many people are. But you can see here. So now you're thinking to yourself, okay, these plans are all the same, right? This is 9 cents a month different. But you can see you need to work into the details here to see which ones apply to you specifically. Doctors first, of course, doctors first, hospitals, doctors, and then medications. You can't skip steps here. Oh, my doctors take it. I want it. Well, your doctor may be fine at the office, but not at that specific hospital, for example. So that said, powerful tools now exist. You can go to, let's just make sure that we've got the right link here. We will have it. Right. Powerful stuff here, which is here's the link sitting inside your comments section now. Right. You can just click there to go to this particular site and you'll be off and running. All right. Quickly to Medicare. We're not going to spend too much time on it here today, right? Again, today is still not financial advice and also not your specifics to health insurance either. It is the annual election period. It started on October 15th. It's already 2 weeks in. Unbelievable, right? In other words, you have the unrestricted right to change Part D plans or Medicare Advantage plans. What I've not been saying, and some people have, additionally asked me that if you want to change to Medigap, right? If you want to change to Medigap, right? This is your time. Okay, this is your time. The reason is our persons to have Medicare, to apply for Medigap, get rejected, and then they've unknowingly don't have health benefits. That would not be good, right? let's presume that you are not entitled to automatic acceptance into Medigap. And I use automatic in small letters because there are multiple ways to get enrolled in Medigap automatically, if you will, without underwriting. Right? If you're within 6 months of the date that you turned on Part B. If you're turning 65. If you've had a special election period. You live in a particular state which is open enrollment all year round, New York. That's different. Generally, you want to be accepted into Medigap first. First. The issue is that this does not happen. The issue is this does not happen, right? Overnight. If you're Mr. Perfect, Miss Perfect, right? You're Miss Perfect, 66, 67 years old, 5'7", 135, never sick, no medications, never drank a beer. Okay, fine. Carriers are going to look for your prescription history first. So if you have no medications and you're 5'7", 135 female, guess what? And no tobacco, guess what? You're going to get accepted. Okay. That said, it's not for, in which case you get accepted for Medigap first. And then when you select a Part D plan, it will auto eject. It will automatically replace whatever Part D or Medicare Advantage plan that you had. It will auto eject the incumbent plan. Okay. That said, please don't choose a Part D plan first because it has ejected your existing Medicare Advantage plan. For example, right? You've trying to change from Medicare Advantage to Medigap. You're Miss Perfect, but you still want to have Medigap after doing further research, understanding more about Medicare, et cetera, et cetera. You're 67. That if you start with Part D first, then it will eject your Medicare Advantage plan. Let's just say, for example, you're not Miss Perfect, you're a borderline case. Right now, you're slightly less than perfect, right? In which case, now you don't get your Part D has ejected your Medicare Advantage, and you don't get accepted for Medigap, and you find out on December 6th. Or worse, you find out on December 8th. Right? In which case, guess what? There's no pathway back to Medicare Advantage in that instance. Now you can understand why I've swerved here. I'm not going to address all of the controversies that are swirling around Medicare Advantage. I'm not going to also tell you that they're completely unwarranted. I'm also not saying that it's not worth it anyway. Right? In other words, there are only 100 videos on Maximize Medicare YouTube channel, something like that, where I've tried to reshape this narrative and trying to react to stories and headlines to get you to not focus on the noise, but to focus on what's important to you and your access to healthcare providers at the price that fits your long-term budget, your priority set. That's not my money. That's your money. Those aren't my priorities. They're yours. They're to be respected. Jay does not care how he got to this spot, right? I can't put us into the time capsule. I can't re-educate. I can't re-inform you about, how the world should or, something works. That is for someone else. I'm here about trying to make it clear what options you have, what the ramifications of the choices that you make is. That's my concern here. right? That's the point of this channel. That's the point of Jay's Corner, which actually where health insurance, Medicare, financial topics, right? Financial topics that deal with your household net worth. And like I said, the good thing about this spreadsheet, I'm patting myself on the back, right, is that this age here, no one said this age is 65. Like people would like want to pigeonhole me inside of a book due to the fact I've written, you know, maximize your Medicare. Oh, on sale for $8 at Amazon fire sale. Apparently, I don't know. I thought I was getting a candy bar for every copy. Maybe I'm not even getting that. Who knows? But my point is that irrespective of your stage of life, you can see it. The same calculus, the same calculation, the same thought process exists. And I'm here's your point here. Here's the last takeaway. You remember I was telling you about Health Sherpa here and about this the calculator. The point here is really that when you're 62, when you're 60, you have your eye on retirement. I'm going to try to retire. I'm going to try to retire within X years. That these numbers here are not fully understood and very subtle. And because the number is so big, right? You're in Tampa, you're 62, your health insurance is $1,500, okay, a month per person. So $3,000 a month. You can see if you can lower this guy. This is now not 8,700. This is 15,000. And now all of a sudden, this entire trajectory of everything that you do can be notably altered, not just kind of adjusted a little bit so I get to go out to dinner, one extra time a month or something. No. We are talking about and I have good memory for certain other phrases that someone else give to me so I can hijack them, right? This is exactly the situation. Uh, you know, Existing physicians, she said to me, it's like, oh, that entirely changes the retirement trajectory. I'm like, yeah, perfect turn of phrase. And I've used it on multiple occasions. And you can see why. Because now all of a sudden, the people who have been delaying early retirement, they didn't want to work for whatever reason. They think that they're set up, but they're worried about this number here in this yellow. Well, rightfully so, right? 1,500 times 2 is $3,000 times. So it's a $36,000 number if you paid the full sticker price in Tampa and you're 63. That's a big number. It doesn't matter what your net worth is, right? We can agree. $36,000 a year, you're talking about, well, not in today's day and age, but you can buy a new car there a year, to give you an idea. Meaning that if you can cut this down, now all of a sudden you can see a pathway where this green now, right, extends. And now all of a sudden these numbers here at the bottom now start to work here as you now continue to add on years. And now you're 67, now you're 68, now you're 69. And now all of a sudden what you thought wasn't possible is possible. In other words, I can understand that people think, Jay, you are, David Downer, and all you're here to do is scare people. No, absolutely not. That is absolutely not the case, right? Which is that I'm here to tell you what is also possible, not just impossible, right? I want you to give it realistic, but if you do understand what exists, then you can take advantage. And I always know that, that these broadcasts, well, here, I'm going to go to financial in a few moments, everyone. But in public is because I'm very sure that someone you know doesn't know. I'm I'm uncertain. I don't have a crystal ball, but I'm pretty sure that that is not a bold statement. Something here, even in the short time, 50 minutes, is overlooked and is life altering to someone. I'm very sure of it. They don't have to be using me, right? There are other people on the planet. Of course, I'm going to be biased, right? Here's my bias, right? Which is I have pretty good command of small details, and those details will matter. They can matter in the thousands, not in the for $5 a year. I'm not going to bother you. I'm not. It's not going to be worth your heartache. But you can see it. It's not. It's $40,000 for that couple in Tampa, and to the young family, 45 years old with a 16-year-old, it's $8,700 a year. $8,700 on their salary of what I put 45,000 is a 20% difference. 20% difference. So you're talking about something that is quite life altering, and it's not because I'm, a proponent or because I represent, the different carriers. That's secondary, because if I told you the compensation rate, it would be like it's embarrassingly low. It's actually wrongly low, that I know, because uh, you know, I'm not going to solve it today. We'll get into it on financial advice or financial markets observations in a few minutes coming up. But you can see that the screwed up thing about the world, of many screwed up things in our world, right? My value as J to the individual household is impacted here big and down here on D, right? As you can see, right? And I probably should have just always just called it this pumpkin bar. This is it pumpkin? Orange? I'm not sure. My point is that my impact on a household can be life altering down here. My compensation rate is like narrow thin. That's the reality, right? I don't control how much I get compensated. I can tell you that, it's not good. 5% is absolutely out of the question, right? But the utility to someone else's life is enormous. And whether that be numeric, whether that be the function. Differently put, however, right, is where we're going now. So instead, what we get is a bunch of headlines to talk about financial markets. Stocks in the long run, grow your wealth, this, that, and the other. Well, even with this massive rip higher over the last few days, massive. This is where we are year to date. So again, for readers of the Substack, please subscribe. Please like and subscribe to the Substack. You can still see this is your year to date. 19.13. This is not the dumb guy here in the room. This is the head of the class, right? There's no doubt. You can see here another example, BlackRock, minus 19.82. You can see here inside of Fidelity, minus 21%. Deep in the weeds, I have left why I think these differences exist beyond today. They're very subtle. Some have to do with marketing, which is a little unfortunate, I suspect. right? Which is you've got some base case of math and theory and the smart guys in the room. They then tweak the model purposes overriding kind of what their academics would have told them, I suspect. That all said, we are just to hear. Even now, we are to hear. Now, I keep telling this to people, and I keep telling this to people because it's a hard concept to keep in mind and remember all the time. Yeah, the headlines are about the up and down, up 2.76% for the S&P 500 on Friday. I get all that. Nevertheless, at every spot, you're returning to here. No exception. What I've been saying is that all of the macro stuff that has been going on in the world, stocks for show, bonds for dough, right? We are right there in the middle of it, right? Which is, of course, right? And this week is this past week has been a very, very good example. Because I defy you to give me the good news of Facebook, Google earnings, even Apple, right? In other words, we got rewarded. In other words, these two big green candles here, because, okay, we were expecting a C minus and got a C plus. Is that what we got? And even then, it's not clear that it mattered, right? In other words, okay, well, that may have been true for Apple. That's certainly not the case for Facebook. And that is your issue here in the sense that, look, but yeah, you got rewarded by a market that went up, what, 5-6% in 3 days? Instead, let's just take a look what happened here. This is not a small move, so you can understand you can understand why I am on this message of stocks for show, bonds for dough. Okay. It goes, oh, well, this is only from 4.2 to 4.01. This is a tremendous move in this space. The reason I have stocks for show, bonds for dough, right? The reason for stating that as kind of one of the mantras here to Jay's Corner, right, is because of the fact that people don't understand the way that this guy works, right? And you can see all the different, these are all different versions of it. People have seen me put this, and I'm typing on the fly, which is the reason that it's showing up in this way on your screen. I understand that we are talking about the denominator, which is R, which is the cost of borrowing, which are interest rates, and then the way that that gets expressed in price. Basically, that's this number here, over here as the R. And you can see this to the T power. So when this thing says 1.04 to the fourth power, you can see how big this number can be and how much it can affect things. As a result, you can see what has happened. Rates lower. Also, by the way, and not coincidentally, the conjoined twin, foreign exchange stable. When you add this up, it is just simply a very simple explanation is the following. We had a backdrop that was stable. We have the world thinking, okay, interest rates can go down from here. Whether or not that is the case is different, right? Whether or not they actually are going down whether the Fed is actually going to step down, I think is the correct term now, being bandied about. That is for someone else to determine. Jay does not have a crystal ball. I'm just observing. But basically what ended up happening, the factors which create bell curve on the right, which pushed it down and made it wider all of a sudden, not all of a sudden, but over these days, the stability here went back here and pushed it narrower. This allows people to take more risk. And in they went. And now you have a narrative which, if you had continued to use this narrative over time since the beginning of Jay's Corner, you could get to the attachment point of what has actually happened. So while it's going to stay challenging, right? In other words, it's not going to be easy, right? You're down from 100 to 81 here, right? You need to go up from here by 25% from here, right? In other words, 100 minus, you could see it. What was 100 at the beginning of the year is now 80. In order to get to break even, you need to go up by 25% from this spot on a portfolio basis. The reason I put this here is not to have a crystal ball, but to kind of explain, what has happened here. Now, this also does shed some light, not on where I think, again, as people know here, right? Not financial advice, not financial advice, not financial advice. So good, I have to put a banner. But instead to give you a feel for what the boundaries of that blue bell curve look to be. In other words, when it got pushed down and wider, right, that then also meant the door can swing both ways, and it happened to swing much higher. Now, given that, again, you may have thought that I'm just only looking at down. There's this door swinging both ways, and that this granularity does point into it. Points higher, you can see a mess up here. That, in other words, we couldn't decide on the used price of my phone. I had a coffee mug I drank. I drank the pot of coffee already, right? Which is that you can see now this amount of congestion. It's going to get tough from here. There's going to be quite a bit of debate around in this area. You can see quite a bit of long indecision in this box. We have returned. So in other words, in a scenario where you go higher, then you can see where we can go. Now we're here. In other words, now we're here back at the red arrow. Now again, we start this exercise of where we can go. Top end look to be up in this notion, right? You can see this bottom wick where I'm putting my line here. 4,100. These are numbers that we've talked about in the past. That under particular up scenarios, what does it look like? Under the down scenario, we now can see it, right? We can see clearly here. Down over here, 36, somewhere in here, probably something like this. Day traders, they're looking at this tick by tick. Tick by tick. I've shown you other YouTube channels, right? Futures Trader 71. Very good. Future Trader 71. Very good channel, right? Professional, actual professional, cold, calculating. Oh, yeah, by the way, on his graphs of financial markets are bunches of them looking backwards, just similarly to here, except for he's doing it and trading every single day, every hour of the day. We don't have time for that, of course, right? Don't have technology and resources and capital, but it does give you an idea. Now, the punchline here is the following. We're almost done, except for the punchlines, which are the most important keys. While I'm telling you and I'm reporting to you that, look, we are still down from 100 down to 81. That is still notably different here in these numbers. Let's just take these two numbers here that I'm going to make purple. Ugh. Not enough contrast to the one just below. So I'm going to go back to let's go back to this orange. I know it's not the same meaning. In other words, I didn't scale this by anything, right? So this was 100 at the beginning of the year. This was down to 75, everyone, at a month ago. So to go from there to 81 here is not too late. In other words, because very consistently what I've said, right? It's never too late to reconsider what the paths are. And I mean this in every exercise, and that also means here as people consider here. You're 45. Now it's also the same. And the reason that I'm bringing this up, and the reason that I've said this on multiple occasions, is because before this other line here, let's just make this another color. This line here, this green line, extra. See, annuity assurance and insurance. These extra financial products, they entirely depended on interest rates, meaning the quality of what you can get inside here. CDs, fixed rate annuities, multi-year guarantee annuity, all the other language, other videos here on the YouTube channel and available. The return profile wasn't good enough. Why? Because interest rates were at 0. And not too long ago, by the way, look at this. This is the 10-year note at 0.53% a year. It is now 4%. When you compound this over time, these are enormous differences here. You can see what I'm saying. 100 times. So what ends up happening is this. Let's just call it at 4%. And you start at $100. Now all of a sudden it's 1.04 equal 1.04. Oh, Jay, you moron. 0.04 times. Now it's 104. Yeah. Well, now you can see it. In other words, you can see now in 6 years. Let's cut out this last, right? 121.06. Before, what used to happen is what? You can remember 121.66, right? It used to be 0.5%. 102. You see what I'm saying? The difference here is so big because of the compounding factor. Because of that, these other lines here are entirely different in terms of attractiveness and then could suggest that this difference, that some of this difference, which is now much better, can be reasonably allocated to other lines. This is so important here. As I've told persons who do have a lot of savings as part of their retirement plan, I'm like, guess what? Your day has arrived. Your day has arrived because now, for example, you can see it in here. Not coincidentally, the market has changed and it has changed a lot, right? Because now you can see instead, even the US 2-year note, a 2-year government bond is now 4.41%. And there it is. So now all of a sudden you can see these numbers are different. And since the interest rate drives the ability to pay by annuities later, the ability to pay inside of universal life, guaranteed universal life, indexed universal life, inside those packages, because you're depositing monies, whether that be annuity, $100 on day one, or paying your periodic life insurance premium, of which some of which that premium goes to interest bearing stuff. And now that compounding here has changed these numbers because now this is not 102.62 later, right? Instead, this now is 104, right? And now this is compounding up. And now you can see now to 121. Way different, $19 different here in just that 6-year span. This is the important stuff here. Be sure to send me questions, leave me comments in the chat, wherever it is. You can send me emails. Of course you can. We've not done a good job of sharing with others, to be candid with you. So much so that I would consider pulling it all behind the paywall because, I realized that, okay, I don't have my makeup on today and all that kind of good stuff. And I'm not dancing like it's on TikTok. So, the appeal, and it looks like a bunch of nerdy work. But the reality is it is knowable. I'm very sure of that. And it's so important to people and the impact enormous in dollar terms or peace of mind terms, none of which I'm here to judge, but just to help you get better control for yourselves. That's all I got for today, everyone. Be sure to like and subscribe. Be sure to get on this newsletter. There's a free and paid version. Of course, today, as usual, I try to talk in terms that everyone can understand. That said, that should not be confused with there aren't further gears and other things that I would possibly share with others. Some too sensitive, candidly, to be left out in public. Alrighty, that's it for today. Have a great weekend.